Wednesday. I'm your host, Anna Stavers. Ketamine is a powerful anesthetic that's become increasingly popular as an alternative therapy for depression, anxiety, and post-traumatic stress disorder. The drug also causes hallucinations and can be found on the black market, often under the street name Special K. And ketamine made headlines when Friends actor Matthew Perry died suddenly last year. It's a lot to unpack, but here to help us understand how the drug works and how it's being used is Dr. David Caldwell, an anesthesiologist and founder of the MiNDSET Integrated Ketamine Care Clinic. Woo. Welcome to All Sides, David.
Thank you.
And joining us is Melissa Briggs-Phillips, a psychologist and the director of the psychological services at MiNDSET. Welcome to All Sides.
Thanks for having us.
So let's begin with the basics. What is ketamine and what effect does it have on the body?
Ketamine's been around since 1970. It was developed at Yale University. It's something I've used for decades as an anesthesiologist. We started to use it a lot more as the opioid endemic occurred. We found that people were coming in on multiple different prescription opioids, and ketamine became popular because it's a great analgesic. It's often used in Children's Hospital because patients keep breathing. It's used in emergency rooms. It was used on the battlefield in Vietnam. It's an effective anesthetic, but we use it in a sub-anesthetic form where patients do hallucinate. It's part of the process.
Yeah, and it was also used at veterinary clinics, right? Like that might be the way some people have come to know it.
Sure. It's generic, it's inexpensive, and it's effective.
So how did ketamine start getting used for mental health treatments?
So I can kind of share a little bit of my origin story with my journey to ketamine and integrating it into my practice. I went to a trauma conference in May of 22 and went to a day-long seminar on the psychedelic-assisted therapy for trauma, and an afternoon session on ketamine bowled me over because my experience of it was when my son broke his arm and he had to have it set when he was 3 years old. And I, at one point in my circuitous career path, had to lock it up in the lab because the graduate students would steal it and sell it at clubs.
Oh my goodness.
So I was blown away to think about this modality. And for people who've been using it for a long time, I'm sure that's surprising. But the research is clear, it's definitive. It is both qualitative and quantitative experiences I've had have been very moving and powerful. The impact that it's having on depression, anxiety, trauma, PTSD, and a variety of other reasons that people might say it with a psychologist or a therapist.
Is it kind of like a guided meditation? Like, how does that work?
For us, it is functioning in two ways. So it is the biological mechanism that Dr. Caldwell could explain. He could probably give you a 12-hour lecture on the actual mechanism of action in your brain and in your body. So for us, it's two things. It's you are hosted in a beautiful space, and you set an intention, and you do integration work after the experience. The anesthetic itself can do a few things. It can sort of say psycholytic, that's the term, where you retain your biography and you retain your narrative, or psychedelic, where you are not there. And so people talk about that as ego death, which sounds like a very dramatic term.
I would say it's multifactorial as well. And Timothy Leary in 1961 used the term set and setting. It's important to realize that the medicine works in and of itself. There are plenty of studies showing new connections formed in the brain, but it's more than that. It's what you discover during a treatment. Oftentimes patients are able to access things under a ketamine infusion treatment that they can't access in their conscious mind. I'm able to record that and share that with them, and then they can share that with Dr. Melissa in psychotherapy, and allows them to break down some of the barriers, to heal, and to let go of some of the traumas in their past. And I think that's why our results have been so really overwhelming as compared to the national standards that you see in academic literature.
Yeah, so ketamine causes what I guess they call a dissociative experience, or what an average person might call a trip. But, you know, one of the things, if you learn about hallucinogenics, is, people describe what they call bad trips. How do you guys sort of control for that? Is that set and setting?
I would say there is no bad trip. It's you, it's your baggage, if you will. It's your trauma, is the things that you need to discover and work through. It's the experiences that you've had in your life that maybe you've walled off and don't want to deal with, and that's what's holding you back. We discover those things and we try and break down those barriers. I make sure that the patient is safe. I have all the drugs necessary if I'm in the operating room to handle a patient care during an infusion. They're monitored with an EKG, a blood pressure cuff, and pulse oximetry. It's what happens after the session that Dr. Melissa deals with, where I feel like we're creating that long-lasting relief.
And that is something, like, I want to be clear for anyone listening, casual use or recreational use is not a treatment for depression. There aren't those safeguards or those settings. And sometimes I think when we talk about a bad trip, like colloquially, we're sort of talking about somebody who maybe harmed themselves or got into a bad situation, right? That like was in an uncontrolled setting.
On October 11th, 2023, the FDA, actually the New York Times published an FDA safety bulletin about the use of ketamine, especially ketamine that can be shipped to your home. You can have a teleconference with a physician and they'll mail an intranasal administration form or a lozenge to your home. We don't do that at MiNDSET. It's all intravenous, purely for that safety profile, as well as it's more efficacious.
And, you know, Melissa, I wanted to ask, do you have specific criteria for taking on patients? Do they need perhaps to have tried other ways to treat their depression? Like, how do you decide this is good for someone?
That's a great question. So for us, the short answer is no, you don't have to have tried a bunch of different modalities and have them not work. That's not true. But we are going to have a really thorough conversation around this modality being appropriate. And it's more of a screen out situation. If somebody is actively dealing with recovery, for example, has ongoing substance abuse or alcohol use disorder, where you have to be super cautious about utilizing this modality for just a handful of folks. But it is not a screen out experience for us. It is, how do we make sure that this is an appropriate tool, and how do we facilitate the highest and best use, best in class care, and sustainability of results? That's our focus.
There are three main contraindications to ketamine infusion therapy. One is someone with increased intracranial pressure, a brain tumor, a brain mass. Someone with unstable coronary artery disease, someone that can't walk up a flight of stairs without getting chest pain or shortness of breath. And then lastly, and probably most relevant in the population we deal with, is someone with a history of psychosis. If you have schizophrenia or something along those lines, ketamine infusion therapy can actually precipitate a psychotic break. So we're very careful to screen those people and unfortunately tell them that they're not a candidate.
So I want to talk about Friends actor Matthew Perry. The actor was found dead in his home in October, and the autopsy revealed that ketamine was a big reason why. Now, I want to be clear, neither of you treated the actor, but he died of what they called, a quote, the acute effects of ketamine. So I'm hoping you can kind of walk us through, what does that mean in a general sense? Like, what does it mean to die of the acute effects of the drug?
I would disagree with that assessment, first of all. He had a ketamine infusion therapy 10 days prior to his death. The half-life of ketamine is about 3 to 4 hours, so it was well out of his system at that point. The autopsy discovered a substantial amount of ketamine in his stomach, meaning he either had a lozenge or he used the intranasal form. He was also on Suboxone for opioid use therapy. In combination with that, ketamine can cause respiratory depression. Unfortunately, he was in a hot tub at the time, and without knowing how much ketamine he used and how he used it, he drowned. And that's sort of the bottom line, but that doesn't get the same sort of clicks on the internet.
Yeah, and it's an incredibly sad situation, but it does sort of get back to what you were talking about, how you can have a telehealth meeting and get this, and potentially it can be life-ending.
He died 17 days after that FDA warning was released and published by the New York Times.
So ketamine is an anesthetic that's approved by the FDA, but many of the ketamine treatments that we've been talking about don't have FDA approval quite yet. Are we on the road to that? Where is that process?
So in 2019, the FDA approved the use of S-ketamine. It's half of a ketamine molecule, and the reason they approved that was extensive research, actually out of Yale. It is stronger than ketamine, but because it's used intranasally, it has to be in order to get to the brain to work. Ketamine was approved in 1970, as I mentioned previously, and it's considered an off-label use, which a lot of drugs we use in medicine are used off-label. But it's widely used and obviously researched by leading academic institutions in the United States. I think psychedelics are coming. I think we're early in the phase here. Hopkins has done tremendous research with psilocybin mushrooms for the treatment of OCD. MDMA has been looked at for PTSD and
that's ecstasy for those who don't know.
That is correct. It is coming, but the FDA moves slowly, and well, it's just up to them.
Melissa, what do you say to somebody who looks at this idea and says, that's a little too electric Kool-Aid acid test for me?
I love that. So I think at a broad level, I could categorize my client base as fitting into like 3 broad chunks. So one chunk might be somebody suffering from extreme depression, life inhibiting or impairing anxiety or panic, suicidal ideation, and then maybe another category would be folks with that inner chatter, that inner voice that kind of rebels on you. So everybody listening right now has an inner voice, and sometimes it's benign and functional, and sometimes it turns on us. And when it turns on us, sometimes it is vicious. So, and then another category would be my folks who are running businesses or leading things and they're tangling with a complex problem they just can't wrap their mind around and they want to solve it. All 3 of those categories of my clients have engaged in an infusion series and had remarkable outcomes. Now, this is not making a proclamation or a promise, but folks that are suffering, that is not too hard to incentivize somebody because they want to feel better. Folks that know that inner voice is turning on them and getting in the way, that conversation and that sort of negotiation or exploring ketamine is a possibility, that it's sort of it leads us on that path, and folks have had really great outcomes. And then the folks who are looking to solve a problem or be creative in how they approach something, the outcome speaks for itself. And so getting folks there is definitely, it's a conversation, it's a collaboration, it's the internet, obviously. Folks listen to podcasts and do their own reading and their own research.
Do you have any concern about some of the sort of online prescribing that like this looser oversight, this like online, like take it home, that we could see like a similar problem with ketamine that maybe we saw with like opioids?
Certainly, it's exactly why the FDA released that statement in October. Anytime you give a powerful psychedelic medication and put it in the hands of an individual without medical training and without supervision, there's risk of abuse. Ketamine in 2019, there were both European studies and American studies showing its safety profile when administered intravenously, as we do at MiNDSET. When abused, it can cause something called interstitial cystitis. It's essentially an inflammation of the bladder, and it can cause incontinence over time. There are a lot of other side effects. It causes an increase in heart rate and blood pressure. If you already have increased blood pressure, it could be quite damaging. So yes, our model, we don't prescribe ketamine to anyone. You come to the office, the clinic, we start an IV, it's administered to you in that form, and you go home. That's our model, that's what we believe in. We believe in the integration, not only the infusion series, but the psychotherapy. Those 2 together is our model. It's unique to Ohio. And does it mean we probably miss out on taking care of some people? Yes, it does. And that's okay because of the results we're seeing, and it's just what we believe in.
And I should say, if you are taking it home, never mix it with alcohol or any other kind of sedative of any kind.
Absolutely.
Oh gosh, and I'll tell you, I've had several clients share this experience is set up to be anti-addictive or abusive, at least the way that we do it at MiNDSET. I mean, if you are doing deep therapeutic work, that isn't always something that you want to be doing in your you don't want to do that in your living room. You don't want to do that in a space that is where you're living your life. So it's set up to be, this is a place where I come and do this deep work. And then I leave this place and go live my life.
I did want to ask, how many sessions, like obviously the psychotherapy, like the therapy part of it could be unlimited number of sessions depending on the situation. But as far as the ketamine, IV, how many times is your average client getting a dose?
So we have something called the induction phase. That's when we really want to break the cycle. We want to silence the inner critic. We want to take away suicidal ideation. And it calls per Harvard, Yale, Columbia, Hopkins, every academic protocol you'll read. Basically, you need to have 6 treatments within a 6-week window. It could be 2 a week for 3 weeks. It could be 3 a week for 2. Most people who have jobs who are busy tend to do one treatment a week for 6 weeks. Patients, every experience is unique. Each treatment for the same person is unique. The dose is increased incrementally over that 6-week period. And you need appointments are 90 minutes, and it takes about an hour to an hour and a half to come back to earth, if you will.
So it's a time commitment for sure.
It is.
Important question. Are insurance companies beginning to cover it?
Unfortunately, Massachusetts is the only state in the United States that covers this, that mandates that it's covered. That's an important barrier right now to taking care of more people in this format. We're working with different nonprofits, currently teaming up with several groups to take care of veterans with PTSD, hopefully through the VA. That's ongoing and something that I look forward to in 2024. And hopefully as we get busier, can team up with some foundations to hopefully create more access for people.
So then what would I be looking at in terms of cost per session, say?
If you looked at any clinic in the state of Ohio for what we're talking about, mood disorders, depression, anxiety, OCD, it's $500 a treatment. It's expensive. It's prohibitive for a lot of people.
And if somebody is interested in getting a hold of you guys, how do they do that?
Our website is MiNDSETKetamine.com, and you can contact us via phone or email through that.
Great. That was Dr. David Caldwell, an anesthesiologist and the founder of MiNDSET. Thank you so much.
Thank you.
And thanks to Melissa Briggs-Phillips, Director of Psychological Services. Thank you. I really learned a lot, actually, so really appreciate it.
Thanks for having us.
Happy to be here.
We're going to take a break, and